Hello, I am Christopher Voss, MD, MS FCCP, the President of Medical Specialists Associates, and a board-certified physician in numerous fields, including anesthesiology, critical care, and neurocritical care. Thank you for listening to this episode of The Art of Medicine about what needs to be protected as the cornerstone of medicine. One evening during a trauma shift, a young mother of 3 was brought to our hospital after a serious car accident. She needed emergency surgery to save her life, and the situation was dire. As expected, she was terrified and overwhelmed with fear. In that moment, I realized that words alone wouldn't bring her comfort. So I gently took her hand, looked into her eyes with all the compassion I could muster, and said, "I know you're scared and I understand. Anyone would feel this way right now, but I want you to trust me. I care about you and I will do everything in my power to take care of you." It wasn't just the words that mattered, it was the sincerity behind them. As she felt the genuine concern in my voice, she began to calm down. Her tears slowed and the trembling eased. She held my hand tightly and simply said, "Thank you." She held on until she drifted off to sleep under anesthesia, her last words before the operation being, "Thank you for caring for me." She survived the surgery and made a full recovery. This story isn't just about a successful medical outcome, it's about the trust and care that define the patient-physician relationship. In healthcare, the most important virtue isn't about making a profit, it's about putting the patient first. This means that every patient should feel assured that their physician will always act in their best interest, not because it's profitable, but because it's the right thing to do. Healthcare often brings us into contact with people at their most vulnerable moments, when they are frightened and unsure of what lies ahead. It's in these moments that trust is most crucial. Our patients need to know they can rely on us, that we care for them as deeply as we would for our own family. In the modern era, however, we are witnessing changes that threaten this trust. The corporate practice of medicine, where large entities acquire physician groups and employ them, and subsequently physicians can lose their autonomy, sometimes prioritizes profit over patient care. Perhaps the most pronounced example of this shift is the entry of private equity into medicine. But this is not to say that business has no place in healthcare. Responsible management of resources is essential, yet to ensure that these business interests do not overshadow what truly matters. The patient-physician relationship must remain the cornerstone of healthcare. This relationship is what safeguards the integrity of our profession, ensuring that the patient's best interests are always at the heart of what we do. And to do this, physicians need to maintain their autonomy. Thank you for taking the time to become aware of this issue so that you, as the patient, remain the true focus of healthcare.